Hello friends, welcome back once again, and today I am going to tell you about a very interesting topic, and the topic is all about why do men have more fat in their abdominal area than women. You will be surprised to know that men finds it very difficult to burn fat from abdominal area in comparison to women. But before we start, let's see the kind of body fat which is basically found in a human being's body. Body fat is basically classified into three types in a human being's body, and one is the brown fat, the beige fat and the white fat. The brown fat is brown in color because of their iron-rich content, because of the maximum blood supply. The beige fat is basically have got a little bit of lesser blood supply, and the white fat has got no blood supply at all, and it's because of that reason they are white and pale in color. And because we know that unlike brown and beige fat, white fat is very difficult to burn from the body, and you will be also surprised to know that the maximum amount of body fat in an adult composed mainly of white fats. Based on their locations in the body, white fat can be further subcategorized into subcutaneous fat, visceral fat and the ectopic fat. The ectopic fat, which is the least in quantity and is basically located within the internal organs. The fat that surrounds the internal organs is generally considered as visceral fat. The epicardial fat and the abdominal visceral fat surround the myocardia and the gastrointestinal organs respectively under the skin, which is also called the subcutaneous fat. Now, to measure the visceral fat, the best way is to go for an MRI or a CT scan. Another simple method to measure visceral fat at the simple comfort of your home is to use the waist to hip ratio formula, which is basically is not a new formula, it's an old formula. So where you have to measure the thinnest part of your belly just above your belly button, and the measure the circumference of your hips just above the top of your butts, and you have to calculate your waist to hip ratio by dividing your waist circumference by your hip circumference. For example, if a man is having 30 inches of waist and 40 inches of hips, then if you calculate it, the figure which comes down is 0.75, which means it's normal. So it means he is not going to have any kind of health issues, and he has got lesser visceral fat. Man should have a visceral fat within the range of 0 to 95, and if a man is having a visceral fat of 0.96 to 1, then he has got moderate risk, and more than 1 it might cause higher risk. Higher risk in the sense means if the visceral fat is more than 1, then the person might suffer from cardiometabolic issues, diabetes, blood pressure, hypertension, etc., and also non-alcoholic fatty liver disease. And in case of women, the visceral fat should be on the side of 0.8 or lower than 0.8, and if their visceral fat is more than 0.81 to 85, they are at moderate risk, and if their visceral fat is more than 0.86 or higher, they will have the same kind of health related issues. Just like you know that the accumulation of abdominal visceral fat in men is not a good thing at all, even in case of women, because it causes a lot of health issues like hypertension, heart disease, diabetes, non-alcoholic fatty liver disease, or also called the fatty liver disease, etc. The main reason why many have higher percentage of visceral fat deposition is due to the fact that the dietary fat is basically absorbed by the enterocytes. Enterocytes are basically active cells which readily absorbs food and microbial antigens in the gut. Gut means the organs that whatever we eat, the food or liquid which travels down through our throat, it contains. The gut means the mouth, the esophagus, your stomach, the intestine, etc. Enterocytes are basically circulated in our body in the forms of chylomicrons. And now chylomicrons are large triglycerides-rich lipoproteins produced in the enterocytes from the dietary fats. And so the chylomicrons in men are generally bigger in size and more in quantity than in women. And during the postprandial state, which means after a person is at fat state, suppose if you eat something and after 4 hours if your blood glucose level is measured, that is called the postprandial state. And these chylomicrons congest the lamina propria, means The lamina propria is a thin layer of mucosa or the sticky inside of the intestine or the food, the esophagus. This is basically a kind of layer of thin kind of mucus layer which is basically found inside the soft organs, inside the gut. This chylomicrons also creates low pressure lymphatics. Lymphatics, which means it will increase edema or fluid retention in the body, which will cause a lot of inflammation in the body, which controls the fluid balance in the body. This condition also helps the chylomicrons, triglycerides, to hydrolysis, means it breaks down the lipoprotein lipase. Lipoprotein lipase is an enzyme which basically digests the fat, which helps in digest the fat. And these free fatty acids, free fatty acids means unstable oils which are not stable like neutral oil, can turn into rancid or toxic. Basically, after that, and this will be stored into the adipocytes, and adipocytes means the lipocytes or the fat cells which stores fat of the nearby internal organs, leading to visceral obesity or abdominal adiposity. And this is the main reason why it explains that men, through their bigger and higher production of chylomicrons, are more likely to accumulate abdominal visceral fat than women. So now you know the facts. This accumulation leads to belly fat enlargement, which also gives men their apple-shaped appearance body due to their tendency of accumulating abdominal visceral fat, and men are more likely to develop an apple-shaped body. That's the reason. And the excessive accumulation of abdominal visceral fat is also known as android obesity, means the other name is the apple-shaped body. And on the other hand, the pear-shaped is often found in premenopausal women or women because of the tendency of accumulating subcutaneous fat in the thighs, the front of the thighs, the glutes, and that's the reason which also causes the pear-shaped body of a woman, and that pear-shaped body of a woman is also known as gynoid obesity. The fact is that a common misconception is that beer consumption can especially lead to belly fat accumulation, but this is not true because this misconception has given rise to the term beer belly. But study shows that beer consumption does not specially increase the belly size, but rather increase the body fat, overall body fat. Therefore, it is unlikely that beer consumption specially increases the abdominal visceral fat or is particularly responsible for android obesity. But that doesn't mean that you have to drink beer, without any hesitation. Be careful. There is a lot of role of hormones and receptors in accumulating or reduction of fat in the abdominal area. The accumulation of fat is also the resultant of higher calorie intake related to energy expenditure from the adipocyte perspective. And another reason is that the fat catabolism of adipocytes or the fat cells is also depend on hormones, especially mediated by epinephrine, because upon binding to the epinephrine to the beta androgenic receptors, lipolysis is stimulated. On the other hand, the binding of epinephrine to the alpha-2 receptors, androgenic receptors, results in the inhibition of lipolysis. In the sense of beta receptors are lipolytic and the alpha-2 receptors are anti-lipolytic, means anti-burn cells. So in short, I would like to tell you that in case of man, they have more of alpha-2 receptors, alpha-2A receptors in the abdominal area, or anti-burn cells or anti-lipolytic cells. And in case of women, they have more of beta androgenic receptor cells, which are basically lipolytic cells, means burn cells, fat burning cells. That is also one of the reasons why men find it very difficult to burn fat from their abdominal area, because of these two receptors. Again, I am telling you, telling you that men have more of the A2 beta and androgenic receptor cells in the abdominal area, or the anti-lipolytic or the anti-fat burn cells. And in case of women, they have beta 2 receptor cells or the lipolytic cells or the fat burning cells in the abdominal area. That's why it's very easy for a woman to burn fat from their abdominal area. There are other reasons like hormonal reasons also for accumulating body fat in the abdominal area and their catabolism. And another reason is that the fat catabolism of adipocytes or the fat cells is also depend on hormones, especially mediated by epinephrine, because upon binding to the epinephrine to the beta androgenic receptors, lipolysis is stimulated. On the other hand, the binding of epinephrine to the alpha-2 receptors, androgenic receptors, results in the inhibition of lipolysis. In the essence of beta receptors are lipolytic and the alpha-2 receptors are anti-lipolytic, means anti-burn cells. So in short, I would like to tell you that in case of man, they have more of alpha-2 receptors, alpha-2A receptors in the abdominal area, or anti-burn cells or anti-lipolytic cells. And in case of women, they have more of beta androgenic receptor cells, which are basically lipolytic cells, means burn cells, fat burning cells. That is also one of the reasons why men find it very difficult to burn fat from their abdominal area, because of these two receptors. Again, I am telling you, telling you that men have more of the A2 beta and androgenic receptor cells in the abdominal area, or the anti-lipolytic or the anti-fat burn cells. And in case of women, they have beta 2 receptor cells or the lipolytic cells or the fat burning cells in the abdominal area. That's why it's very easy for a woman to burn fat. In most scenarios, you have seen that women also find it very difficult to burn fat from the hip area, and that's because of another reason. They have anti-burn cells or the A2 receptor cells, androgenic cells in their hips area. Just like men have more of alpha cells in their abdominal area, so vice versa. So that's why women find it very difficult to burn fat from their hip area or the glute region. So lastly, before leaving, I would like to tell you that of all the factors contributing the accumulation of abdominal visceral fat, lifestyle is arguably the most important thing. Based on the proposed mechanisms, spreading on the amount of dietary fat intake into several smaller meals should reduce the likelihood of abdominal visceral adiposity or fat gain in the abdominal area. So the suggestion, according to me or according to science, the suggestion is that you need to have a low fat diet. Low fat diet means you should not have more than 10 to 20% of your overall calorie intake from fat. So if you are taking a 2000 calorie diet, so 10% of body fat will 10% of your calorie intake will be 200. So if you divide 200 with 9, because 1 gram of fat contains 9 calories, that comes hardly around how much? 200 divided by 9. You just calculate and find out. And so if you calculate 10% of 2000 of your overall calorie intake, it comes down to 200 calories, right? And if you divide that 200 calories by 9, because 1 gram of fat contains 9 calories, so it hardly comes down to 20 to 22 grams. So a person, an individual who is having 2000 calories every day should not have more than 20 to 25 grams of fat every day, divided into several meals. So this is one of the way through which you can reduce the abdominal adiposity. And along with that, regular exercise also causes the flow of chylomicrons properly, and it also inhibits the congestion of the lymphatic cells, and as a result there will be no inflammation, and as a result, you guys, that's it. Remember, a very good lifestyle and low fat diet of not more than 10 to 20% of your overall calorie intake will reduce your abdominal adiposity. So keep pumping, keep training hard, and keep eating clean. Have a good day ahead. Thank you.